I decided that I would like to get involved in being a public representative within the NHS following a comment that my doctor made to me when I was talking to him about retiring. And his response was, "Well, Angela, what are you going to do with your knowledge and experience?" That set me thinking. And I realised that yes, I had had a lifetime of experience which could still be useful to other people. Because of my own health needs relating to Ehlers-Danlos syndrome, I had always been involved in the health service, both as a practitioner and very much as a patient, and working with other people who also used the health service. And as I say, I was coming up to retirement and I really wanted to use certainly the early years of retirement in a productive way. And by volunteering to become a member of my practice's PPG, I felt that I was addressing some of these thoughts. The next step was to actively become involved. And around about this time, my GP's practice put out an invitation for patients who were interested in becoming part of their soon-to-be formed patient participation group. Consequently, I applied and was accepted and became a member of that group. Initially, as I was still working full-time, it was very low-level involvement. But then, as I retired, and as the representative that was going to the patient reference group network found that at times she felt less than effective at these meetings due to understanding terminology and presentations, I offered to begin attending these meetings. From there, my diary began to get very full because soon after I began attending the PRGN, there was a call for anyone who was interested to join the Patient and Public Experience and Engagement Steering Committee of the Clinical Commissioning Group. I've also become quite proficient with letters. Anyway, seriously, I put in an application and was successful, hence how I've come to this point today. What does being involved through PPG, the Patient Reference Group Network, and hence with Greater Huddersfield Clinical Commissioning Group mean for me? Actually, it's meant an incredibly steep learning curve, as I've realised that I really do need to obtain a wider understanding of what healthcare means to the wider population. It has been very useful to have had my background to draw on, but I've found myself accessing other documents, talking much more to my friends and neighbours about their experience of healthcare and what they would like it to be. I must admit, I've also felt that there is a role of helping them to understand how the NHS is now working and the difficulties that it's facing. In a way, by talking to friends and neighbours and even family, it's made me realise that whilst I'm involved in a patient reference group network and then the CCG, in reality it's allowing us to involve the wider public. In a way, it's helping us to feed downwards and also to collect information from a much wider circle of people who use the services and who will be able to have input into future planning. The other thing that I do receive from being involved is that I am still actively involved in other areas of work related to health needs, especially within the Ehlers-Danlos community, and it's very good to see how everything can tie up and work in together. It's also good to know that in many ways I feel I am giving something back for the care and involvement of professionals that I've received over the years. This was particularly highlighted recently at a Care Closer to Home stakeholders event, where to see the input that my fellow public volunteers had led to a completely different set of outcomes, which were very much more patient-related outcomes. it's very encouraging and exciting to think where these might lead us all.